responses to accessibility of healthcare. So instead, katong first, quality to, now we're going to be talking about accessibility of healthcare. All right? So starting with me, um, I I saw a specific response that said, as far as I have observed, a few hospitals are able to provide proper healthcare and accommodate sick people. It's pretty simple, but it speaks huge volumes. You feel? You feel. Okay? Because the starting words, the person said, as far as I have observed, a few hospitals are able to provide proper care. Okay, and knowing we are a country that is very full of individuals that want to be medical professionals someday. You know, it's very common for a Filipino to want to be a nurse. In fact, it's a stereotype na. Di ba? Unya, it just boggles my mind nga a lot of us want to be nurses, but our healthcare is one of the worst in the world.
Like
So
they want to be nurses but abroad.
yeah, and I can't really blame them because my cousin, who is a nurse, who just graduated and passed her board, she's now working as a nurse. She spent 6 years of her life studying and having a bunch of headaches for a salary of 10,000 per month. That's not including tax yet.
Oh,
So
that's
minus,
so
yeah, minus
Myra
pa na sa tax. So
for a
that's like mga
nurse.
3K minus. So she gets 7,000 a month. Okay? For
Okay.
being a medical professional. She's in charge of people's lives and she gets compensated 7K. I mean, you
What
can't blame
the?
them for wanting more compensation. That's a human life you're dealing with and you're only getting paid 7K. Dude, I wouldn't care if I get paid 7K. That's not enough. You're not paying me enough to care if you live or die. I mean, that's just my mindset, you know, like as much as I hate to say it, money matters. And the money is usually circulated and controlled by the government, you know? Economy is controlled by the government. And I just wish nga the government really does something about how much they compensate nurses and doctors. Maybe not doctors, but nurses. Yeah. How about you, Tammy?
The response I took interest in was I haven't had any first-hand experience, but I assume these services should be readily accessible despite some drawbacks due to the increase in patient traffic. Now, I don't have any doubts on the accessibility that Filipinos can have towards, healthcare, be it medicines. You can go to any pharmacy and purchase them there. That's good accessibility there. The vaccines are free and they're pretty much open for everyone who's registered and stuff like that. There's got to be a process, and I understand that maybe not exactly bureaucratic, kind of processing, but there has to be some sort of pattern of some sorts to maybe get people registered and whatever, and like making sure everything's runs smoothly. I can understand the frustration that maybe in trying to do all of that amongst a wide spectrum of healthcare services, like from public or private. I remember that a teacher mentioning that private hospitals are actually accredited by their health insurance providers, meaning the health insurance companies that are associated with them. So I can understand that their processes aren't actually that uniform. Maybe they have different standards, criteria, they have different salaries. I just thought that if these are like really private companies and whatever, who's regulating them? Like, as in, are they being held accountable for rejecting any patients? I've read a
Mm-hmm.
study that the Philippines has been reported to be one of those lower income or middle income countries that has been known for rejecting patients' treatment. And
Yeah.
as simple as
Mm.
that statement means, patient can mean anyone who's on the verge of death or pretty much just going in for a regular checkup. In either case, it's unreasonable. I don't understand how come, these private companies have to make, I mean, yeah, maybe they need to make sure you're able to pay. But okay, I actually did another read. I was looking for sources on the paper, and then I remember reading this weird link from Google Scholar. it was a study, but the introduction read more like a story, a news article, and I'm pretty sure it was set in the Philippines. I think it was in Bacolod. It told the tale of a young girl. Her mother was trying to get her to several hospitals, and she was already in critical condition. The mother had spent about an hour trying to go to the first hospital, and as they were already there, already she was like relieved that they made it in time, that she could finally have her daughter's care be left to the professionals. She was rejected right at the emergency room, stating because she didn't pay or anything regarding finances. But the mother assured them that she would have the money ready. She just needed more time. She was even willing to pay upfront some amount the very next day, which sure wasn't the full amount, but at least it was something. But she was still rejected. And then she was advised to go to another hospital, still far away, to get treatment there. And then died on the way there. It's like I remember the names were withheld. I'd like to believe it is true. I'd like to believe that um there is a weird I don't know, a weird pattern or weird trend amongst healthcare facilities and insurance companies um regarding anything related to treatment, but it was just a little weird. I mean, the accessibility is there, but then you're still rejected by policies, and those same policies were made by the people who built those hospitals. It just unnerves me a little that they had so much control over such things. I I thought that maybe this couldn't be considered legal. I couldn't possibly like comprehend that it could be allowable in any court for a hospital to reject a patient, but I guess it was still acceptable, like due to the circumstances. The patient would not be able to pay or whatever, but then a life was lost. So
Yeah, these
it's weird.
stories, like,
Sucks. What
even
the?
though you don't go through it, it really frustrates you. Like, I there was this news that I saw. I actually have the article open, that a baby was held over unpaid bill. Imagine.
A baby?
Yeah, a baby was held in the hospital because the parents weren't able to settle the payment yet. And then here, the Department of Health is asking the management of a hospital in Metro Manila to explain why it refused to release a 10-month-old baby over an unpaid bill amounting to 1.1 million. A 10-month
1.1 million.
10-month-old baby, huh?
What?
Wait, what? So it's been there? Like, the
I have
baby's
no idea
been
if,
there?
I don't know if ever since birth, but yeah. Wait here,
That is.
it's so, diba? It frustrates you even just listening to it.
Yeah.
Who's like breastfeeding the baby for like 10-month old still?
Yeah.
Grabe, I can't imagine the pain of the mother.
Yeah. It's so
1.1 million for what? For
I
for
have no
kuan?
idea. For payments, ambot lang. Kailangan po ng ating mga hospital magkaroon pagkikiusap sa mga pasyente kung paano mababayaran. Maybe through promissory notes and other mechanisms. Pero bawal po na ang dinedetain natin ang ating mga pasyente. So,
Yup.
if you didn't understand what that meant, that's in Tagalog. The hospital should have made compromises like through promissory notes or other mechanisms, because it's bawal. It's what's bawal ganikal? Kanang it's not
Prohibited.
allowed. It's prohibited, yeah, to detain a patient just because of that.
My goodness.
Imagine. It,
Yeah.
I don't know. I don't have words for
It's
it, but it really
yeah,
makes
it
me
makes
go
you
like,
speechless. It really makes you speechless. Yeah. But as much as we want to dwell on that, let's hear from Adri.
Okay. So the response that I chose for this one is the person said same with its quality, it could still definitely be improved. Meaning the accessibility. So healthcare accessibility has always been a struggle, and it was only emphasized during COVID when hospitals ran out of space for patients and numerous were left untreated. I feel like I feel like we the Philippines definitely one of the countries that was really unprepared for a pandemic, like a situation like this. I feel like other places are they have more, what do you call this? They have more, like they're just they're more prepared because they have like more you facilities or like something like that. So, yeah. And it just we had to like reach reach a point where it's already a global pandemic for us to realize that our healthcare system is not it.
Mm-hmm. How about you, Niv?
Um, for me is limited nurses and doctors available. So we only have a few patients that can be accommodated and treated in the hospital rooms. And so I chose this because I noticed a lot of our medical professionals prefer to work abroad because it has better opportunities like salary. Now I understand why they would choose to work elsewhere, but this is really terrible for us because we're not only lacking in manpower, but in resources as well. So if we pair that up with the fact with that we pair that up that we have limited nurses and doctors, more people will go untreated. And another point I'd like to mention is that with since we have limited medical staff, right? So those with better financial backgrounds would probably get the most attention from our professionals, while the ones who can't pay are either a less priority or worse neglected. That's all. Thank you.
Yeah, that's just two questions from our research, no? But then the facts don't lie. Those are the findings, and that's the beauty of doing research. It's bad. That's not coming from us.
It's
That's
bad.
not coming from
Period.
us. That's coming from the people themselves. All right. And on that note, we have went a little bit over time, but for a good cause because we were
Yes.
talking about the truth and nothing but the truth. All right.
Amen.
Bye bye, everybody. Thank you for
Bye,
listening. Bye
guys.
bye.
Bye
Thank
bye. Tune in next
you.
Bye
time.
bye. See you next
Bye bye.
episode.